Greetings everyone. So once again, I want to thank you for joining Dr. Gerald today as we're going to continue our discussion. It's Fracture Nights with Dr. Gerald on Dr. Gerald's Helpline. Now, we talked about sometime during the last session that we're going to be doing this particular session for distal radius fractures. Now, the fracture is a break in the continuity of a bone. Now, when you have any fracture that occurs, now I have a mannequin here, something to demonstrate for us to be able to appreciate. Now, this is the radius bone and this is the ulnar bone. Now, that's what forms the wrist joint with the hand. Now, fractures occurring around this place are called distal radius fracture. They are very, very common in the environment. They are seen commonly in those elderly people and also can be seen in young people following high energy injury, usually from falls or from road traffic accidents. And in the elderly, especially the females, because of the hormonal changes that takes place, they have the risk of osteoporosis, and so when they have a slight fall and trying to break that fall, they have a high risk of having a fracture of the distal radius. Now, what is the common presentation? Now, you have a patient who has a history of a fall, and then they have pain at the distal part of the radius, just close to the wrist. There is a history of swelling, and very remarkable, there is a deformity. Now, there are different kinds of deformities that you may see. Some of them we describe. The most common one is called the dinner fork deformity. So the hand takes the shape of a fork that is used for eating. So you have that usual shape of the wrist is lost, and then the individual has that dinner fork shape. And then you also have another reverse dinner fork deformity. Okay, so you can have those kind of things occurring around the area where there's a fracture. Usually there's tenderness, that's pain when you touch that area, and inability to use that hand because of the pain. It can be very, very painful. Now, once there is this condition, don't try to do home care. You immediately will hold that hand gently and take it to the hospital and see an orthopedic surgeon. Now, once the doctor sees you, the orthopedic surgeon or the initial physician who sees you, they bring in the specialist and then will see you. The next thing would be to go ahead and examine that particular patient. Okay, on examination, we're going to find some of these features that we've discussed. Now, you're going to see that the bone is broken at that particular area. Usually when the bone breaks, it jams together, and so it can be very painful. All right, now for the treatment and for what is done for this person, most of the time we want to take care of the pain. We're going to give you some medications for to take care of the pain, and analgesia, and then we go ahead and prepare you for the immediate treatment. So before the treatment, we will have you do some investigations, and very importantly is that you're going to have to do an x-ray. And doing an x-ray, we'll look at the nature of the fracture. Now, there's what we call the collarless fracture. Now, this collarless fracture is the typical one that I described, where the bone is broken and then it bends usually backward. All right, that's called a dorsal displacement. Now, dorsal angulation. Now, when this occurs, it gives you the classical dinner fork deformity. Now, another one can happen is when the fracture occurs, but this time, instead of the bone angling posteriorly or to the dorsal part, it angles to the volar part. That's the anterior part. And that's called the Smith's fracture. There are different kinds of them. Okay, now you can have that the bone fractured and then it broke into little pieces. We call that comminution, and then extends into the wrist joint. Okay, when there's an intra-articular extension, we call it the Batten's fracture. So there are different kinds. I don't want to bore you with all that, but the most important thing is that an x-ray is done, and that helps us to confirm which type of fracture that you have. And then we go ahead to plan for an immediate care. The first step you have is taking care of the pain, and then there'll be need to manipulate that particular arm under image guidance, okay, and go ahead and apply a cast. The cast is applied usually below the elbow, or in some cases where there is comminution or is a Smith's fracture, you may want to go above elbow for the initial period, and then subsequently it is cut to below elbow, and then you have mobilization of the elbow joint to prevent stiffness. Now, once the splint or the cast is applied to the hand, we must make sure that the hand joint here, which is the metacarpophalangeal joints, are free because they can get stiff. And so that allows you or whoever has the fracture to be able to exercise appropriately, to be able to use that hand when the fracture heals. There are situations where we'll need to open up and fix. For those unstable fractures, the surgeon may decide to fix. So whichever one it is that is decided that is the best for your case, like we said, you can write into us, we can advise, we can recommend, and that way you're getting the best care out of the situation. It doesn't have to end with a sad note. It doesn't have to end with a complication. Yes, they are there, but largely they are preventable. And that is why we're coming to you to inform you that yes, you can do something about it. Most people are afraid of surgery. Most people have different kinds of notions. We want to encourage you that some of those dogmas or some of those things that you've heard, not all is true. You need to come out and ask questions. That's why we are here, for you to send in those comments, send in those x-rays. We can advise you, we can help you to be able to take that decision that is best concerning your health. And so once again, we want to say thank you for tuning in today. I hope this information is able to help you take the right decision when you have anyone around you. It mustn't be you, anyone around you have a fracture. Tell them you don't have to do home care. You don't have to get the advice of someone who is not an expert, who does not understand the fracture, okay? And then you run into complications. You want to reach out to the doctor. The treatment is done that day. The person goes back home that day, comes back for checkup, x-rays, comes back for removal of the cast, and that ends the treatment. And that history will always be remembered for good and not for sad notes of complications that follow. So I want to say thank you for tuning in today. Once again, I want you to keep your eyes open as we are going to call on you again soon for the next session, because we're going down to the upper limb. Now we're entering the main part where we're going to be looking at very serious fractures. We're going to be looking at fractures that are around up the lower limb. We are completing our upper limb fractures series, and so I want you to tune in. So next session, we're going to be talking about fractures that occur in the hand. So watch out for it and see you soon.